Hello, my name is Monica Cuitiva, and today we are with Dr. Howard Boker, world famous oncologist from Boker Oncologists. Doctor, we're going to talk about gastroenterology cancer today.
Okay, I think we're going to talk a little bit about stomach cancer. Um, and we were talking about topics to bring up, and stomach cancer is seems to have come to the top of the list, partly because we have this very nice Bristol Myers Squibb FDA double checkpoint trial, which
Okay.
is really something new and worthwhile uh, for patients with gastric cancer, a disease in which there hasn't been much in the way of change for years. And I'm a long distance. I can't do it. Not now. I'm sorry. 30 minutes. How many minutes? 30. I can't do it. Come upstairs? Yeah.
No problem.
Okay.
So, doctor, when you say that, can you explain us a little bit more about this new product or
Please go ahead.
that is on research?
Basically, as everyone is hearing, the immunotherapy and checkpoint drugs are becoming. So basically, everyone has been very excited about the checkpoint drugs for the last 2 years. Uh, every time another study comes out and they're finding that there are long survivors with these drugs and that an increasing fraction of the patients benefit from these drugs and more diseases are added to the list uh, for which checkpoints are suitable options to increase survival. It's the big thing in that it's the new modality in oncology. And gastric cancer is one of the diseases in which the phase 1 initial trials showed that there were responders. So that is a motivation to try what we're calling double checkpoint. Double checkpoint has been combining two methods of improving the patient's T cell ability to destroy tumors. Uh,
So that's what the medication does.
yes, what the medication were, there are two medications. One, we could say, empowers the T cell,
Okay.
and the other medication prevents the tumor from protecting itself from the T cell.
Oh, wow.
Yes,
That's
big deal.
yes, it
It's a
is.
big deal.
It is.
It's people didn't understand why the immune system wasn't protecting people from cancer, and it turns out that tumor cells have molecular structures, molecules that can block the T cell from destroying them. And there are processes that, on the other end, that prevent the T cells from mobilizing and doing their job. So now we have drugs that work on both ends of the problem, and the so-called dual checkpoint treatments put them together. In the lead diseases, melanoma, cancer of the skin, and lung cancer, putting them together has really made a difference in survival and response rate, and one expects that the same will happen in other diseases. And some of the diseases where checkpoint didn't look so good, when they used either the T cell helper or the stripping off the tumor's protection, when one or the other mechanism alone failed, when the two are combined, bingo, you have what you want.
Okay, doctor.
So,
So that was the difference in between the way the gastro cancer behaves in if we compare it with, for example, in women, like for example, breast cancer.
you've picked the cancer that is particularly difficult for checkpoint. It's one of the cancers where the immune therapy has not yet taken hold in a big way. Now there are exceptions. For instance, women who have what are called triple negative breast cancer, which is a very important subgroup because the normal hormonal treatments, which are so important for controlling breast cancer, don't work. Those patients, there's a group, if you use the checkpoint drugs before surgery, sometimes they get very dramatic tumor shrinkage. And there may be, they're starting to think they found a window, a subgroup of breast cancer where checkpoint will work and that there's a window in time as well. That's probably going to be true for stomach cancer and every cancer when we learn how to take a more sophisticated approach. Right now, we're still at the point of throwing the drug into the fray for desperate patients. And people are saying these are miracle drugs, treatments of last resort. But we know the closer to the front of the battle we get, using them earlier,
Of course.
this is probably going to make them much better treatments.
Okay, doctor. So tell us what's the importance of people participating in the cancer trials, like for example in the gastro trials that have been they have discovered so much and it's already advanced.
Well, the reason I'm so interested in gastric cancer, we're doing 3 trials. We're doing gastric, we're doing ovary, and in fact, we are doing breast. We picked 3 that are considered difficult challenges because having a double tool increases the chance you'll be successful. And the other reason is we know from my earlier work that we've seen people who've gotten other treatments, and the other treatments have been so effective that, we don't do that for everyone, but we've seen it happen often enough that we suspect that there is going to be a way to integrate, that we're seeing signs that immunity is playing a role. We give them our treatment and they survive so well and so long that we know it's not simply what we gave them, but their body must be coming online and helping. So if we could do something with checkpoint drugs to do even better, we know that when we integrate them correctly, we have real hope of making a difference. But
So,
we,
so, doctor, excuse me. When you say we, you're talking about when the treatment that you're doing, the one that you are doing research.
well, yes, it's
Okay.
it's our programs, treatment programs we had before that we think will be the good partners and make and give Checkpoint their best opportunity to do good things for people. So we pick those diseases because we think we can help before, during, and after. And the reason I said that gastric was important is because just a couple of weeks ago, by coincidence, I had two people come into the office, and both of them had stage 4 cancer more than 10 years ago. Now, normally with stage 4 stomach cancer, people only live a couple of months,
Yes.
a year. Some people will live longer, but these people, 10 years, no treatment, they're fine. So,
Wow.
but you see, that's the kind of result that tells you, we think it tells us, that the immune system can play a role. If you can damage the tumor, sometimes the immune system can create a miracle. And the checkpoint will make those miracles happen more often. So we're very excited about a disease like that. Now, I already reported at the national meetings in 2006 that we were seeing people with end-stage stomach cancer who appeared to be cured with third and fourth line treatments.
So this is
And
happening
these-
for a long time.
Yeah, so we said it a long time ago, but it just fortuitously new patients, not part of that original cure
Research.
group. It's like, again, we've seen additional evidence that there are people who at the last moment can have these apparent cures. So that, to me, says that immunotherapy will have a role. The other disease, people for years have seen patients like that with melanoma and kidney cancer. And those were the diseases where Checkpoint made its first great successes. So I'm hoping, I expect that the same thing is at least very strong theoretical possible. No one can promise.
Yes,
We
of
never
course.
know. But the theory is the best game in town. If you wanted to pick a new treatment option to do something, not the same old stuff that doesn't work, Checkpoint is where, and double checkpoint is where you want to go. It's a desperate disease, and here is, we want to make a difference.
Well, you certainly are doing a difference already. So, doctor, how will people, find out more about this kind of research, like general people, because not everybody knows about it, and they probably would like, to participate or read more about this research?
Well, we're on the FDA. We're on the clinical trials website, and if someone Googles Bruckner Oncology and shoots us a line, we of course will, provide the information. And Dr. Hoffman, who is a principal investigator in this series of trials in New York, his office can also be found on the internet, and he can also provide this type of information. So, but we're very pleased, and we're about to get going in a serious way now with the Gastro Project, since we've been inspired by having these people just fortuitously come in for their one came for the annual, and one just came out of the blue because she wanted an opinion for a friend.
Oh.
If I could do the same thing that I had done for her.
Wow! So that means it had gained some popularity in between doctors. This kind of treatment.
Well, the immunotherapy with these so-called checkpoint drugs has gained a great deal of popularity among oncologists, and a lot of doctors in general, and the more scientifically oriented non-doctor population, they find immune therapy extremely appealing because it's the closest to nature of all the treatments that we offer people. Now, I am not a critic of standard oncologic modalities. I found they help a lot of people.
Of course.
And yes, we know chemotherapy can be toxic, but the degree of toxicity is in the hands of the doctor. You don't have to make it too toxic for an individual patient. There are boundaries. Same with radiation. It's a toxic treatment. We're using poison and damaging rays to kill tumor. And of course people are concerned, what else do you damage besides for the bad cells?
Of course.
Now, the difference is with checkpoint, the first thought is, oh, we're not damaging anything. We're doing the opposite. We are correcting the normal cell. We are removing something bad. So everyone's very excited. But
wow, you got me excited now too.
Yeah,
It's just amazing.
But we want to be honest with people. Every treatment is a two-edged sword. What
Of
we
course.
always tell the medical students is one of the most dangerous drugs in America. Aspirin. It's the simplest drug. Aspirin. It kills more people and causes more bleeding probably than any other drug. So it has to do
Wow.
with volume and statistics. Everything is a two-edged sword, and the doctor has to do his best to use the weapon safely. Why am I saying this? Is because when you make the immune system stronger, especially when you make the T cells work better. What you can do is you can make the T cells attack normal tissue, like the thyroid and the adrenal gland, and other organs as well. Now, if we watch what we're doing and we use, it doesn't happen that often, but if we know what to expect and we're watching, we can prevent that from becoming too serious almost all the time. So it's still a safer treatment in knowledgeable hands than the traditional chemo and radiation. But it's something that should be done by people who have experience
Of
and
course.
know how to handle it, because it's a powerful tool.
Doctor, do you think this kind of treatment will help in other conditions?
We're pretty sure that it will. This year at the ASCO meeting, they were describing the first patients with prostate cancer who were benefiting. Up till now, people have said that you can't, that these checkpoint drugs don't help people with prostate. But now, the Royal Marsden in England has reported that yes, there are people with prostate cancer who benefit. Now, I'm treating people with prostate cancer with immunotherapy. I'm doing it in parallel, but I'm not making any claims.
Of course.
Some of the interesting things at ASCO this year were, for instance, that if you combined the immunotherapy with the hormone therapy for prostate cancer, or with the BRCA2 drugs, what are called PARP inhibitors, the checkpoint drugs worked much more often. These are probably examples of turning tumors into vaccines in the body. There was just a lot of publicity about a breast cancer success in which they took the cells out from a patient, removed the T cells, put them in a test tube, and then when they put the T cells back in the body, they had armed them so that the T cells ate up the tumor. Now we think that we can arm the T cell in the body. If we damage the tumor, the antigens and the surface of the tumor change. And this stimulates the tumor. It's like putting blood in the water for a shark. When the T cell sees these foreign antigens, it will come and attack. And when we change the membrane of the cell, it becomes vulnerable. It's like opening the gate of the castle, and the T cell can come in and do its job. So, these are now being done for prostate cancer. And, we think we have the chemo modalities to do the same for stomach, for ovary, and that's where we're hoping to go.
Well, doctor, it's been a real pleasure. I really learned a lot. This is for me, and of course for many people that don't really know yet about this, is a breakthrough. and we're hoping this actually shows all the results that you're looking for, and it works just as well in
It's
in many
certainly
other
something
conditions.
that the results are going to be important. People we're going to learn and do, and hopefully the individuals who participate will get personal benefit as well.
Yeah.
Thank
Okay,
you.
doctor. Thank you very much. Have a lovely weekend. And
You too.
and again, it's been a pleasure. It's been a really, actually, it's been an honor to meet you.
Yes. So nice of you to say that. Pleasure. You-
Okay. Okay,
Thank you.
doctor. I'll see you soon.
Thank you.
Okay. Bye, doctor.